Welcome to Ocean County Focus. I'm Donna Flynn, your host. Joining me today is Dan Regney, the Public Health Coordinator for Ocean County, and we're going to be providing you with an update on where Ocean County is and the Ocean County Health Department on COVID-19. Dan, thank you so much for joining us again. This is getting to be a routine here.
Yes, thank you for having me.
It's been 19 months now that COVID first struck Ocean County. Things seem to change almost every day. And really, my first question to you is, where is the health department now with responding to COVID-19?
Right. I mean, a lot of the activities that have been going on for the last 19, 20 months are still going on. The one that's most in the forefront are the vaccinations still. We do continue with the vaccinations. We started back in December 24th, Christmas Eve, and we haven't looked back. We've done hundreds of clinics throughout the county. We have shifted everything from a single mega site to a larger regional model to a community-based model. Now we have a hybrid of both of those as we enter the fall of 2021, offering both fixed facility sites throughout the county as well as community-based model clinics as well. That really any resident of Ocean County can go within a mile or two of their home. If they want to get vaccinated, they have the opportunity to receive any of the three vaccinations, the Moderna, the Pfizer, or the J&J, as well as the seasonal flu vaccine and the pneumococcal vaccination. These are all available at any of the clinics that we're offering at this time.
Now, you've actually gotten to the point, though, where you had closed down some of your larger sites, and now you have kind of regrouped and reopened some of them, and that's in response to this, to the pending boosters, if you will. Let's talk a little bit about that. Where is Ocean County with the booster shots?
Right, so back in mid to late August, we had some word from the state that we would get the booster approval through the CDC. Some of that has happened, some of it has not. We're still waiting on the full approval to do so. At this time, the booster is available for the Pfizer recipients that received the Pfizer at least 6 months prior with their second dose. So we're offering that at any of our sites, working closely with all of our partners, the VNA, OHI, COMED, the hospitals, and there's a lot of opportunities out there right now. As we get more information and that will open up, we're able right now to offer that. We just don't have the ability to do so for that. The one exception is that if anybody's immune compromised at highest risk of severe illness, and that's for Moderna or Pfizer, they can receive those third or additional shot now at any of our clinics right now.
Explain the terminology on the boosters. I mean, there's the third shot, there's a booster shot. Who needs to get a booster? Who should be getting a third shot? How does this all work?
So right now, the third additional shot is available for anybody who received the Pfizer or the Moderna vaccine 28 days after their second shot. These are people who are at very high risk of severe illness, very high issues of immune compromise, health conditions. They can speak to their healthcare provider to see if it would be recommended for them. If they show up at one of our clinics, all they have to do is say that they are immune compromised. They spoke to their doctor, and we don't need proof of that. We don't need a doctor's script, a doctor's order.
So this is somebody who might be on chemotherapy, or somebody who's diabetes, that sort of thing.
Correct. So now the Pfizer booster shot, which is different than the third additional dose, is for anybody 6 months after their second shot of the vaccine. Those are for individuals 65 and over right now, as well as people working in high-risk employment, such as in the healthcare field. They might be working in providing patient care for individuals, as well as those who may have other immune conditions that may not be the high-dose component. And a lot of this information is listed on our website, and they can also contact their physician and healthcare provider based on their health condition. It may be recommended for them based on that. And they can contact us as well.
So with the booster shot, though, too, is that recommended for everyone? Is it something that you could get it? What's the suggestion for it? So
right now, eventually it will be recommended for everybody as it goes through the different trials with the FDA and the ACIP and the CDC. And they're looking at a lot of that data to make sure the information that they have that's safe and effective, and everything that is being shown at this time is that it is very safe, it is very effective at preventing the severe illness and the mortality with this. So that eventually will be for everybody, but right now what they're looking at doing is trying to prioritize where the highest risk individuals of the severe illness, which we've seen that back in the last year and a half, it's really the seniors that have been hit hardest with this.
Now, and folks who are in line for that, they can get that at any of your clinics right now.
Correct.
Now, your larger sites again would be the Toms River High School North, Southern Regional Middle School, and I believe out in the Ocean County Road Department garage, actually out in Manchester Township.
Correct.
Is that correct?
That is correct, yes.
So do people need appointments for these? Do they,
We recommend appointments. They'll go through the clinic flow a little bit more rapidly, but it is not required. We are accepting walk-ins as well at this time.
Also, these booster shots, are they the same strength as, say, your first and second shot, or is there a little bit of an adjustment with them?
It is the same dosage right now. I think we're waiting on the guidance, and that may adjust as we go forward with some of this, also depending on different risk factors based on age. Children, once that's approved, there might be a smaller or lesser dosage of that. I'm hearing that Moderna, that vaccine with the booster, when it gets approved, will be at a lesser quantity as well, but it's the same vaccine, just have a lesser quantity.
And this is really, I'm asking you to look into a crystal ball at this point, but do you think this would be something that would be continuing? I mean, after you do the booster shot, will next year be a booster shot, or will it be like a flu shot where you just go every year? What do you think?
I do think there will be probably some kind of an annual component to the vaccination program. We operate the annual seasonal flu vaccination program, and I can see it very easily being incorporated and integrated into that because just as the seasonal flu vaccine mutates from year to year, the same thing is happening with this COVID-19, the coronavirus. It's a virus and it does mutate, and that's where we're seeing some of those strains. Some of them are more concerning than others.
How many people in Ocean County are fully vaccinated?
We're actually doing pretty well. We're over 60% now of the eligible population that is fully vaccinated. So that's going very well. I think people have taken that information seriously, and they've availed themselves to the vaccine. So we're on the right path. And I would just recommend to everybody to talk to their healthcare provider, look at the circumstances within their family, and make that decision if it's the right decision for you.
With such a large senior population in Ocean County too, and a lot of them are homebound, what sort of help is being provided to them through the health department?
Yeah, we do offer a homebound vaccination program. We've offered that historically through our seasonal flu vaccination program. We've just taken that model and modified it for the purpose of the COVID. So for the last 8 months, we've been offering that at home. If anybody is homebound, they can come and they can contact us. We will send a public health nurse to their home, vaccinate that person, their family members, caregivers within their home, and we'll do the same thing for seasonal flu as well going into this fall.
Have you found, because I know in just looking at where you're holding your various clinics and stuff, and I know that they are throughout Ocean County, some of them have been within the library, in the actual library systems, if I'm correct. Has that been successful? Have people been very, do they have a good response to that as they get closer to you, if you will?
Right. Yeah, the Ocean County Library has been a great partner with us over the years and just delivering basic public health programs and prevention. The seasonal flu vaccination, we took that and expanded to the COVID vaccination as well. What's nice with the Ocean County Library system, it's dispersed throughout the whole county. So it's many of the municipalities have a branch of the library that they're familiar with, that they're comfortable with, and providing that vaccination at that location has been a benefit and a true convenience for the residents of Ocean County as well.
And Dan, we're actually going to take a quick break. We're going to be right back here on Ocean County Focus.
Hi, I'm Freeholder Ginny Haynes. Join me on this tour of some of Ocean County's premier park sites. The Ocean County Department of Parks and Recreation has something for everyone. Try us out. You won't be disappointed.
The Ocean County Board of Commissioners, working to make Ocean County a better place to call home and a special place to visit. The Ocean County Board of Commissioners, working to make Ocean County a better place to call home and a special place to visit.
Welcome back to Ocean County Focus. My guest today is Dan Regney, the Ocean County Public Health Coordinator, and we're talking about updates and all things COVID-19, although we will also be talking a little bit about the flu shot and stuff coming up too. Dan, when we went to break, we were really talking a lot of specifics as to, where are the vaccine clinics for COVID-19 and working with seniors and stuff, but just in general, what are the challenges that you continue to face with this pandemic?
Yeah, I think there's a lot of challenges, and you kind of compare the response with COVID to other responses that we've done over the course of time. I would think a couple things. One is the messaging. I think people are much more in tune with social media and the internet, and there's a lot of information being posted on the internet and being shared through social media that's really not accurate and not true. So I think a lot of it is trying to correct some of the information, get the best information out there to the public, and a lot of our messaging to the residents of Ocean County is to stay informed, but stay informed through credible resources in ourselves and State Health and CDC as they go through this, and try to do your own research, but at the same time, the research has to be from a credible source.
Right. I mean, also too, are you working with the schools and stuff too when it comes to whether it be the vaccination or outbreaks or anything like that?
Yeah, the schools and the children, obviously, we're working very closely with them and trying to help them, guide them through the process. A year and a half ago, in the summer of 2020, we started a back-to-school task force. That's remained in effect for the last year and a half. That task force is a team of our staff at the Ocean County Health Department, includes the superintendents, the principals, the school nurses, and anybody within the school that's working on the COVID front related to contact tracing and disease investigation within the schools and responsible for putting their plan forward. So we help them, we've guided them through them. We've been on numerous calls with them to be able to help them. And it's there's not a day that goes by that we're not speaking to some superintendent, principal, or school nurse to help them interpret some of the guidance from the CDC and the state.
Right. In general, how are the schools doing right now?
They're doing a great job. They really are. I think when you look at the task that's been put in front of them, and they're shifting from an educator role to a more of a health and safety role, which is, there's a gray area between the two. And integrating the learning component in a safe school environment for the students and the staff. I think they've done a great job. I mean, it's a very difficult job that they've had. Sometimes the guidance coming down from the state and the federal government's not the clearest. And some of the guidance comes in from the State Department of Health as well as the Department of Education. And sometimes that is conflicted, and we help them try to clarify that and navigate some of the road back documents for the schools.
I mean, because I think everybody's goal here really is to make sure that the kids are able to stay in school this year, and that they don't have to continue to do that flip back and forth to remote and stay home, and maybe So I mean, again, it's got to be difficult decisions for all of you.
It is difficult, and as a parent of 2 school-age children myself, I mean, the best place for these kids is in school. I mean, from the social aspect, the mental, the cognitive, being at home in front of a computer is not where they need to be. There's so much more to this than just the learning component. There's a social aspect of it, and the integration with their friends, which I think they missed a lot last year. So they do truly need to be in that school environment, and everything that we can do collectively to help them be there in a safe manner. I think we've been helpful and really made a lot of progress to assist them through that process.
Another, just to kind of switch topics the slightest bit, it's flu shot season, believe it or not. I mean, it's like, wow, how did that happen again? What's the health department's role right now, or your goals as far as getting flu shots out to the general population in Ocean County?
I mean, from the flu shot component, it's business as usual. We have a very rich history of providing flu shots, which I think has helped us with our COVID response as well. Back in the 90s and early 2000s, if you recall, we would administer 45,000 flu shots every year to the seniors in Ocean County. That has decreased based on other suppliers that are out there. But we are moving ahead with that. We have many sites, about 60 throughout the county,
Okay.
that are our traditional seasonal flu vaccination sites. And plus, we have our fixed facility sites that we mentioned for the COVID vaccine. But all of our sites, whether they're COVID or flu, we'll be offering all the vaccinations that we spoke about.
Now, if I am not vaccinated against COVID-19 and I go for a flu shot, can I get both the same day?
You can get them both the same day.
How do you determine, though, if I have a reaction to something, what determines what I'm reacting to?
Yeah, in the beginning, going back to last January, the recommendation from the state was not to co-administer the COVID with any other vaccines, not only just the flu. But I think we have enough data information right now that the recommendation from the state is to co-administer because they have enough data at this point looking at the side effects, and they really are minimal with
Right.
that. And I think they have a much better sense with that, and they are consistent with more of a like a soreness at the site, maybe a little bit tired. On the COVID side, you might run a slight fever with it,
Right,
but it's certainly much better than getting active disease
Sure,
for either one of them.
Oh,
with that.
absolutely. Why, in recommending the flu shot for folks, is it mostly for seniors? Is it for everyone? Who do you recommend the shot for?
I mean, it's really for anybody 6 months of age or older.
Okay.
For that, remember, with the COVID, it's typically affecting with the severe illness our seniors. Seasonal flu is typically you're young and you're old. So what we want to do is get a level of protection and immunity out there on the seasonal flu as well. So we really recommend it for anybody 6 months of age or older.
Great.
We have different types of vaccine. We have a high dose vaccine that's meant for our seniors, and we have a seasonal dose for others that's a quadrivalent. Will protect against 4 strains of the flu.
I was going to ask you about that.
Two
because-
A's and two B's.
Yeah, in the
for
past, I
that.
always know that there was always kind of a look at what sort of strain might be most prevalent, and that's sort of what the vaccination kind of mirrors or takes care of. So
Correct.
that's still the way this works.
Yes, the planning for seasonal flu begins almost a full year in advance. We
Right.
placed our order for seasonal flu back in January and February, and we predict what that demand will be, as well as the manufacturers in formulating and in manufacturing that vaccine to distribute. So we put the order in back at that time. We're actually just receiving shipment about 2-3 weeks ago,
Okay.
and we started vaccinating about a week ago for the seasonal flu as well.
Give me some idea of where your flu clinics are actually located. Are they in senior communities? Are they in community centers? Are they,
The answer is yes, all of that. We're in senior communities, we're in the libraries, we're in community centers, we're in firehouses, we're in some of our administration buildings in the health, the county buildings. We are all over the county in different facilities.
Now, do I need an appointment for a flu shot or
No,
from
you
the
do
health
not.
department? I mean,
Correct.
I know that, again, you have a lot of other partners out there that do flu shots now. So do I need an appointment?
All of our sites are walk-in at this time. If demand does increase, we will probably shift to an appointment basis, but right now, we don't anticipate that. And it will speed them up to go through the process, but it's not required.
Another question is, I think a lot of, and this could actually be misinformation that I'm going to ask about, but you hear a lot of people say, well, no one got the flu last year. Why should I get a flu shot? And how did the flu disappear? Should I still get a flu shot just because the numbers were lower? I mean, I'm assuming that somebody got the flu last year.
Yeah, you should still get the flu shot. Everybody should still get that. If you remember at that time, though, all the prevention messaging that was put out to the community, to the public, that's to prevent any infectious communicable disease, not just the COVID. So
Right.
everything that we were talking about, cover your cough, stay home when sick, wash your hands, all those are just good public health messaging. We've been saying that for years and decades. It prevents the spread of any kind of infectious communicable disease.
Great. Dan, we're going to take another quick break. And we're going to be right back here on Ocean County Focus.
The Ocean County Board of Chosen Freeholders, working to make Ocean County a better place to live and a better place to visit.
The Ocean County Board of Commissioners, working to make Ocean County a better place to call home and a special place to visit.
Hi, I'm Freeholder Ginny Haynes. Join me on this tour of some of Ocean County's premier park sites. The Ocean County Department of Parks and Recreation has something for everyone. Try us out. You won't be disappointed.
And welcome back to Ocean County Focus. Dan, when we went to break, we were talking about flu vaccinations for this year and the importance of folks getting them. In addition to the health department providing flu vaccinations, you also provide pneumonia shots.
Correct.
Who should get pneumonia shots? How is that determined?
The pneumonia shot should be really received by anybody 65 and over. That's not an annual vaccine like your seasonal flu. Anybody under 65 would require from us a physician script to get that vaccination. If anybody has any questions related to it, they can contact their healthcare provider, look at their health issues that they would have in their health history, and they can make that recommendation. But anybody 65 and over can go to any of our clinics and receive that
Is that a
vaccination.
one-shot or a two-shot series for the pneumonia vaccines?
There's two different that are out there. There is a one-shot, and we're offering the two-shot as well.
Okay.
With that.
And they can get that at any of your flu clinics, is that correct?
Correct, yes.
Okay. What about when it comes to the elderly, the homebound? How can they access the service of flu vaccinations?
Yeah, so we do have we've had it historically, the active homebound vaccination program. They can contact us, main number 732-341-9700, and it's Nursing Administration extension 7303.
Now, will you actually send someone to the home, or do we try to have a caregiver bring them somewhere? What's the most convenient
We
way?
will send a public health nurse to their home to vaccinate not only the person but their family members and caregivers as well.
Oh, that's a wonderful service,
Yes.
really, when you think about it.
Right.
Now, I know that we have focused mostly on COVID vaccines and flu vaccines today, but the Ocean County Health Department provides a number of programs to the residents of Ocean County, and I just wanted to talk quickly or talk about a couple of the other ones. I mean, do you offer vaccinations for children childhood diseases, if you will? Does the health department provide them?
We do offer a number of vaccinations. On the childhood side, we would typically refer them to one of the two federally qualified health centers, OHI or COMED,
Okay.
Which is more of a medical home. The two federally qualified health centers are relatively newer, within the last 10 years. We did used to provide those vaccinations, but it was just the vaccination that we were not a medical home
Right.
for those children.
Okay.
But we do offer other vaccinations for some of the adults. We offer the shingles vaccination. We do offer some of the post-exposure rabies. For any residents who may be required to receive that as well. We can help them coordinate that and some others as well on an as-needed basis.
Also, Women, Infants, and Children's, the WIC program, is that still administered through the health department?
It is. We actually operate the largest WIC program in the state of New Jersey. We have two administrative sites in Lakewood and Toms River.
Explain what it is.
So the WIC program is Women, Infants, and Children. It's a food supplemental program for women who are pregnant, breastfeeding, or children up to 5 years of age. There are qualifications that they would have to qualify for from income eligibility. If that's the case, they would be screened by a nutritionist, and they provide food vouchers to be able to be redeemed at some local vendors throughout the community, as well as the markets throughout the summertime here in Ocean County as well, to get some fresh fruit.
Now, is this like a program where you would follow these families, if you will, to determine how they're doing, or?
We do. There is a case management component, so to speak, and they do check in with the residents that do qualify. They're able to meet with some of the peer counselors for breastfeeding questions that they would have on the nutrition side. There's nutritionists that can answer any questions that they would have as well. There's different healthy components of like height, weight, blood work with the kids
Right, right.
that are integrated into that program as well. So it's a wonderful program
Yeah, I was gonna say,
for
it's
the
gotta
women
have a lot
and
of
kids of
benefits
Ocean
for-
County, and there's so many great success stories that we're hearing from some of the residents.
Yeah, which is so important because, again, like I said, I think in the last 18 months or so, everybody has been so consumed by COVID that they don't even realize the other stuff that's out there at this time, which makes it a little bit more difficult for everybody to get that why is it so important for people to get that preventive health care?
Yeah, I mean, all these things that we're talking about, nutrition is at the core of health. Like we even talked about COVID. One of the best things you could do to preventing severe illness of COVID is just get healthy,
Right.
eating healthier. So that's where the WIC program comes in for the women and the kids. Even just staying active and healthy, getting out there and trying to shed a few pounds. There are things that people can be doing right now that will help them across the whole continuum of health, not just
Right.
in the COVID front. So these prevention programs like the nutrition program with the WIC and all the other programs that are out there, whether we provide or others, don't ignore your screenings based on your age and what's recommended for you. Make sure that you're staying on top of all of that, and you're the best advocate for yourself and your own health.
Absolutely.
You know where you're at. Monitor your symptoms. Your body will tell you when something's not right. Don't ignore those symptoms. Go for that screening. Go for your annual checkups because it's so important on your overall health.
One of the things that we were actually during the break we were chatting about, Ocean County, not Ocean County, October is Breast Cancer Awareness Month. And does the health department provide any sort of services for women that may be low income as far as getting screenings are concerned for that?
Yeah, we do offer screenings for, they can contact our nursing administration program as well, and that's the 732-341-9700, extension 7303. They can help them guide them through services that we offer related to that, but also refer them out. If we don't provide it, we can also refer them out with an information referral of other partners within the county that do provide other services as well.
Now, and the health department has also been doing this for a number of years, though. It's a Pretty in Pink Day, Handsome in Blue, I
Yes.
believe. And is the health department still doing that this year? And what's the idea behind that?
Yes, that is still going on. It's really just to bring awareness, just to
Right.
remind people that some of these things are out there, that there's basic prevention screening tools to be able to remind you to go for that screening.
Right.
It is so incredibly important. If you catch some of these things early enough, the outcome is so very different
Sure,
in the long
absolutely,
run.
absolutely. Also, another area that the health department works with is environmental.
Yeah.
So what are some of the programs that fall under environmental?
Yeah, all the food establishments we inspect, over 3,300 in Ocean County alone. We just wrapped up the recreational bathing, so we monitor and we test all the waters for recreational purposes throughout the county. And we work with the towns to assure that the water safety that's out there as well. So there's a very active component.
Right, you guys are pretty busy over there then.
Yes.
And I think we're actually going to get wrapped up on this particular segment. The last thing I'd like you to talk about is, again, how do people find out about all these clinics and the information, and where do they need to go for all of this?
Yeah, the best information source would be our website, www.ochd.org. They can certainly contact us as well at the main phone number, 732-341-9700. And we have a phone tree that they can go through based on what the request or what the information is that they're seeking out.
Dan, it's wonderful to have you on the show again.
Thank you.
Thank you all so much for joining us today here on Ocean County Focus. Stay well.
The Ocean County Board of Commissioners, working to make Ocean County a better place to call home and a special place to visit.